Okay, so here we are, Meaning in Ministry. I'm Tom Edmondson, and joining me again today is Dr. Anna Niiles-Maki from the Institute for Purpose-Centered Philosophy in Finland. This is actually our fifth podcast. And right off the bat, I have to thank you so much for your generosity in sharing your wealth of information with us. And I want to say that this has been a project 2 years in the making. Have you realized that? It's amazing.
Yeah.
So you published your book, Handbook for Logotherapists, in 2024.
Yeah.
And then in 2024, we began the first of five podcasts to talk about the very essential arguments that you bring in. And we did two in 2024, and this will be our third for 2025. And it is December the 10th. So
Yeah.
uh, thank you for this gift of your time and your wisdom. And reflecting back, I hope that you have learned something in this process.
A lot. A lot. Thanks, Tom,
You're
for
very, very welcome.
everything.
So I am going to just let you get to it. The two-stage separation diagnostics of disorders in logotherapy.
Thank you, Tom. And thanks for having me again.
My pleasure.
And please feel free to interrupt me at any time with your comments and very good questions. You always have very good questions and comments. So
Thank you.
feel free.
I
Okay.
appreciate that.
Thanks. So before we begin, I would like to raise two primary questions. They are not here in these slides, but the questions are there really disorders that emerge in the neurological dimension? So I raise this question because if Viktor Frankl says, the neurological dimension of consciousness is healthy. So if the neurological dimension of human consciousness is healthy, why do we then talk about disorders? What do you think, Tom?
Well, that's a great question. And for me, I can see how it's a conflicted question because, on the one hand, when I have do pastoral care, say for someone with dementia or someone who's bipolar or whatever, I can see how behind the psychosis there is a human being, and I'm very fond of telling the story about my grandmother who was dying, and she was on morphine to the point that she was not really aware of, I guess, the reality the whole time. But if we sang a song, she knew every word, and she knew how to pray. And I'm always remembering this. But I've always struggled with this because I think that there are people I, who have, I would say that they have willfully blocked their noetic self, if, for lack of a better term. Um, Biblical terminology, they have seared their conscience, which means that they have taken a hot iron and burned it so that it has lost its sensitivity. But I, I, I would say that a disorder in the noetic sphere would have to be a spiritual crisis of some sort, you know.
Yeah.
Um, and so I struggle. I know I said a lot of words and maybe not much sense came out of that, but uh,
Yeah, you were right. That was a great answer to
oh,
this
thank you.
because Viktor Frankl himself discovered while treating his patients, he was a neurologist.
Hmm.
He discovered that there was a separate dimension that he couldn't reach these tools he was given. So he made a conclusion that there has to be something else. There are problems. People have various kind of problems, and he didn't have any tools to reach these problems, to heal them, to make them better. So he discovered the existence of the neurological dimension. And when he says, when he writes that neurological dimension is healthy, he means that it's ontologically it's healthy by its existence is healthy. It is healthy, but when it's interactioning with the situation, and by situation I mean now the situation defined by Lauri Rauhala. And as you remember, I don't remember now which podcast talked about Lauri Rauhala, but the situation I have here in my book, the description, Lauri Rauhala's description.
Yes.
Situationality is existence as relatedness to one's own life situation.
Mm-hmm.
So when our neurological dimension is functioning in connection to the situation causes something that affects the neurological dimension, the functioning of the neurological dimension, a conflict. Right. And that is a serious state. Mm-hmm. But it's not psychological state. It's not psychic state. So mm-hmm. It has to be something else. So actually, the disorders or distortions of the neurological dimension, they really are a healthy reaction to a sick situation.
Mm-hmm. Right, yes.
Like Viktor Frankl says.
An abnormal reaction to an abnormal situation is normal.
Yeah. Okay, so the second question that arises is that if we agree that there are disorders that emerge in the neurological dimension of consciousness, so why do we need a specific diagnostics for them? Couldn't we just use these international diagnostic classifications of mental disorders? And by them, I mean ICD-11, European classification, and DSM-5, which is American classification. Why couldn't we just use them? Why do we need these two-stage separation diagnostics of disorders? What do you think?
Okay, once again, this one I think is easier to answer, and I think because they do not recognize or may not recognize the neurological dimension of humanity. Probably they do not, and therefore their answer would be reductionistic. From the perspective of dimensional ontology, they would be looking up rather than being on the same level as the neurological.
Yeah. Again, you are absolutely right. These classifications, they target to our psychic dimension, and our psychic dimension is related to our somatic level. But they do not recognize at all the sole existence of the neurological dimension of human consciousness. So, if for some miracle happens and they do understand the existence of neurological dimension, it would mean that they would have to change the whole framework of the diagnostic of disorders and the whole framework of the consciousness, the definition of the consciousness. So it would be a huge step forward. But in the meantime, waiting for that, we need to have these two-stage separation diagnostics of disorders in logotherapy.
Right.
We don't have really We really don't have a choice.
Right.
We need to have this.
So this is really, a supplement to what is standard training in terms of clinical psychology or whatever.
Yeah.
Okay.
So let's start with I have some slides, and if it's okay with you, Tom, can we start these slides?
Absolutely. Please do.
Okay, thanks. Uh, so we have to start with the definition of diagnosis, what it means. In medical field, diagnosis means two things. It means a judgment about what a particular illness or problem is after examining it. And it also means the making of a judgment about the exact character of a disease or other problem, especially after an examination or such a judgment. And in medical terminology, the concept of diagnosis, it refers to both the process of making a diagnosis and its outcome. So we know that medical knowledge changes very rapidly, and diagnoses do too. And this is because many factors outside the field of medicine also influence the popularity of diagnosis. And we know that. We all know that.
So I do have a question then to interrupt. I think
Yeah.
I've mentioned this before, but here in the United States, we are constantly bombarded with commercials during TV shows and so
Mm.
forth about all kinds of medications. I think I've learned about so many afflictions I have never heard of before thanks to watching TV. And
Mm.
is it true or not true then that in other countries such as yours that you do not see these sort of medical advertisements or pharmaceutical advertisements?
They really are not as allowed in Finland and
Hmm.
maybe in USA. We have
Right.
we have restrictions about these
Right.
things, and the medicine. I should. I think it's safe to say that 95% about all medicine are from description made by a
Hmm.
doctor. So
Right.
we go to
Super.
pharmacy and I have a description about it, prescription about it,
Right.
and
Sure.
we get it, and doctor has licensed it to
Hmm.
so that we can have it. So uh, advertising these, I don't know the exact point because
Oh,
it's
okay.
always, we have to always go to the doctor
Sure. Well, I
so that
think the
we can
truth
have.
is, I think that to use Frankel's terminology, I think it has an iatrogenic effect. That I didn't know I had this problem, but it's
Yeah, I might
jokingly,
have this.
you know,
Mm,
if you're my age or older and you forget where you put your keys, somebody's gonna say, "Oh no, hopefully it's not dementia." But forgetting where your keys are is not dementia. It's just
mm,
whatever. But my point is that the more they advertise, the more people go to their doctor and say, "Oh, I think I've got chronic halitosis. What do I need for that?" And I saw an advertisement, and the most uh, hilarious thing about this is that while they're showing happy people doing fun things, talking about their medicine, the fine print at the bottom is may cause
yeah.
you to die. Is your hair will
Yes,
fall
I
out,
know.
and so the
Yeah,
side effects are so bad you don't want to do it. But but
yeah,
but
yeah. Still people buy them and think
yes,
they are helping,
yes.
despite the
So
side effects they don't know about, or they are just too lazy to find out about them. I
right.
have written about this in in my dissertation. I have a chapter called Logotherapy and Medicalization.
Okay.
I it's not translated in English, but I think I at some point I will make an English article about it.
Yeah, that would be great, I would think. Because your last sentence here on this slide says many factors outside the field of medicine also influence the popularity of diagnoses. And unfortunately for us, advertisement really drives a lot of that here, which is a bad thing.
I watch a lot of foreign, channels, TV channels.
Mm-hmm.
I want to know what's going on in the world and what kind of TV shows they have. And I think I feel shocked because all the advertisements about medicine and the kind of medicine we don't get here by going just shop and just buying them. They can. And I think it's very dangerous.
Agreed.
And it really can cause, uh, how do you say, iatrogenic
Mm-hmm.
neurosis or iatrogenic distress or this sort of
Mm-hmm.
thing. It really can,
Agreed.
and it will. But okay, can we go to the slide 3?
Yes.
Okay. So there are several, actually 5 different traditional types of medical diagnosis. The first type of diagnosis is diagnosis of symptoms. And that means a description of symptoms or findings or a combination of them for which criteria have been agreed upon. And the second one is an anatomical definition. So it means that injuries are defined based on their anatomical location. This is a it's related to somatic
Mm-hmm.
things.
Right.
And the type 3 is the definition according to causality. And it means that the etiological factors of the disease are identified as exact as possible.
Mm-hmm.
And the fourth type is diagnosis based on syndrome. And this is very common type of diagnosing. And
Mm-hmm.
this is often the initial stage of diagnosis before a more detailed understanding of the disease process and its etiological factors. The definitions and criteria for syndromes are often discussed at conferences and scientific articles, and they may change as research progresses. And the fifth and the final traditional medical type of diagnosis is exclusion diagnosis. This
Mm-hmm.
is a type of a diagnosis in which the main part of the definition consists of a list of things that the patient has not been found to have. So excluding everything and then finding
Mm-hmm.
something that
Right.
might be the right one.
Right.
So what does diagnosis then mean in logotherapy? In logotherapy, making a diagnosis, it includes 2 stages. The first stage means an assessment of what a particular problem is or is not, and it's
Mm-hmm.
based on existential analysis of the client. And this means the fifth uh, type of medical diagnosis, exclusion diagnosis. And in logotherapy, it's called separation diagnosis.
Mm-hmm.
And after making this is the second stage. And it means assessing the exact nature of the problem, especially after an analysis or such an assessment. And this is type 3, the
Mm-hmm.
definition according to causality,
Mm-hmm. Right.
which means which is called in logotherapy is called detection of the cause. So these are 2-stage diagnostics of disorders.
Mm-hmm.
I have used 2 types of medical diagnosis. Uh, type 5, exclusion diagnosis, and type
Right.
3, the definition according to causality. And the Two-Stage Separation Diagnostics of disorders means the practice or techniques of diagnosis, which include the diagnostical stages 1 and 2. First, the stage 1, and after that, stage 2.
Makes sense.
Thanks. So, in order for logotherapy to be used in the treatment of disorders of the neurological dimension, it's necessary that we return to the basis of logotherapy, and I mean logophilosophy.
Mm-hmm.
And to treat disorders of the neurological dimension, and I know it's a long-term neurological dimension of human consciousness, so I just talk about the neurological dimension.
Absolutely.
Uh, we have to treat the disorders of the neurological dimension correctly within the framework of the regional ontology. And now it comes. It was presented in podcast 2. And in
Yes.
my book, it's on the pages 16 to 23.
Okay.
And this a framework of regional ontology. It shows how to understand disorders of the neurological dimension as qualitatively different from psychical or psychological or psychiatric disorders.
Mm-hmm.
At the center of these orders is the experiencing, non-experiencing, distorted experiencing of a purpose uh, in relation to the agents of the neurological dimension and to the situation. And here the situation is means Lauri Rauhala's definition of the
Mm-hmm.
situation. So we need to study or we need to explore and understand and explain human existence from the neurological dimension.
Mm-hmm.
We need to identify and separate disorders of the neurological dimension from disorders of the psychic dimension of consciousness.
Right.
And this thing
Mm-hmm.
requires the practice of the stage 1 in the two-stage separation diagnostics of disorders. And this is what I call separation diagnosis. The disorders in the psychic dimension are qualitatively different from the disorders of the neurological dimension. And this is justified clearly by the logotheric theory of human consciousness. And this was presented in podcast 4.
Mm-hmm.
So we need a classification model in which the distorted interpretations of the contents of meaning in relation to the situation are qualitatively separated into their own categories.
Right.
Separating them into their own categories is defended by the fact that distorted interpretations of the contents of meaning in relation to the situation, they require different treatment methods depending
Mm-hmm.
on the functional and or the qualitative genesis of the distortion involved. And this is because the disorders of different dimensions are of different quality already
Mm-hmm.
on behalf of their contents of meaning. And this is some example. For example, how we understand the world and ourselves in relation to it.
Right.
Are we living our lives hoping to maintain or achieve happiness? And this can lead us to a meaningful life. And this is the functioning of the psychic dimension
Right.
of human consciousness. Or do we recognize ourselves as moral agents with freedom of will and the great responsibility that comes with it? And this leads to a purposeful life, and which is the functioning of the neurological dimension. So this is just one example of the content of meaning.
Mm. Yes, I really like the fact that you have used the word distorted or distortions in this because it refers to our interpretations, to our understanding. Since in the noological dimension, it's about the will, it's about it's everything you said makes total sense. And in a lot of ways, it's just common sense, but you have to spell it out uh, because someone who goes to a psychiatrist with depression, they may say, well, let me give you an antidepressant. And then they may come back and say, well, it's not working. I'm still depressed. So they either give them a higher dose or they give them a supplement to, and of course they never treat the problem. And that can go on for decades. And I'm not saying anything new here, but I just really like the fact that what really works in logotherapy is not trying to medicate the problem as if it's a psychological or somatic problem, but recognizing that it's the stories we tell ourselves that,
Yes,
so
you're right.
I feel like Dr. Watson in the Sherlock Holmes stories, you know,
I
the
don't.
purpose of Dr. Watson is just to sort of help the audience understand how smart Sherlock Holmes is. So that's what I'm doing right now.
Thanks. Okay, and now we come to this term of the existential frustration. And this is a term used by Viktor Frankl in many of his books. It's a good term, but we have to understand that it serves as a general description of those human experiences in which the experience of purpose is distorted. When a person experiences the loss or disappearance of purpose, or the distortion or distorting a purpose, or the absence of a purpose, the possibility of implement the purpose is hindered. And however, this experience of hindering, and by this I mean the term of the definition of the existential frustration, the experience of hindering is very different for different distortions related to experiencing a purpose. And the term frustration, it really does not adequately describe all distortions related to experiencing a purpose. And in addition to this, the genesis of distortions related to experiencing a purpose, they differ either functionally or qualitatively from each other. In the genesis of a distortion related to experiencing a purpose, the functional process means the conflict between one of the two agents of the neurological dimension and the situation. And now we have to bear in mind that these two agents of the neurological dimension, these two primary actors, I call them agents, they are self-distancing and self-transcendence.
Right.
And without them, there couldn't be any functioning of the neurological dimension at all. So this is why they are agents. And therefore, the distortions related to experiencing a purpose, they must be classified specifically into four main categories. Because they differ either functionally or qualitatively, or both functionally and qualitatively. And this requires the practice of the stage 2 in the two-stage separation diagnostics of disorders. And this is what is called detection of the cause. And here I have a picture about all these. So at the center, you see the general description of all the distortions. And these are specific distortions which all consist of this existential frustration. They all are part of this existential frustration, but they are more specific.
Right.
Because this existential frustration is somewhat a little too general. So we need a specific classification. So there's category 1. In category 1, purpose is lost or gone. And these are two different things. Purpose can be lost or lost for now. So I don't have a purpose, I have lost my purpose, but I maybe I can find it again. But if
Right.
my purpose is gone, it's gone for good. So it's they are different things, but in both of them, purpose is is not in our sight in any way.
Right.
And in the category two, purpose is missing, so we don't have it. And in the category three, purpose is distorted. So something has not something, but I don't recognize myself and my purposes anymore. It's about that kind of
Mm-hmm.
situation. And in category four, purpose has been distorted by the situation. So
Mm-hmm.
there are uh, there are strict difference between categories three and four.
Mm-hmm. Yes.
Because in category three, a purpose is distorted, means that I have had a purpose. I have had
Right.
many purposes and I have implemented them. But something happens in me
Yes.
and
Yes.
I don't recognize them anymore.
Right.
Like in burnout syndrome.
Mm-hmm.
One day I wake up and I question, what am I doing in this life? Who am I in this life?
Mm-hmm.
What is my job? Why don't I feel any purposes in my job anymore,
Right.
for example? And in the category four, it means that the situation around me, it may force me to implement purposes that are not mine.
Mm-hmm.
So I have to implement purposes that I don't feel genuinely as purposes.
Right.
And in some groups, this may happen. In some ideological groups or any other groups, it may
Mm-hmm.
happen. Or in some cultures, it may happen that
Mm-hmm.
I have a conscience and I listen to my conscience, and this culture or this group wants me to believe that their purposes are according to conscience. And for me, they are not, for example.
Mm-hmm. Mm-hmm. I was going to say between one and two, and between three and four. As you explained it, when you explained it, I think it made a whole lot of sense. Is it possible to say that with number one and number three, something outside of me has changed and it is affecting me, and in three, two, and four, something inside of me has changed? That may be a little too general, a little too, but
Mm,
maybe I did it.
uh,
Maybe I did that backwards. Um, Purpose is lost or gone. Number one, I was doing this and I felt a sense of purpose, but now I don't feel. I'm not feeling it. Maybe at this moment I don't feel it, and maybe later I will. Uh, but the purpose was there. Now it's gone. The second one, whatever the situation is, you can't find it. You didn't see it from the beginning. Sort of the situation. Um, anyway, I'm just kind of talking my way through this. It makes sense to me, um, but I was trying to find a parallel between one and three, two and four. Maybe I'm
yep,
pushing it too hard.
that that was a very good uh, uh, explanation.
Okay.
But uh, I always uh, advise my students, logotherapy students, to when they are confused about
Mm,
this, I always advise them to ask themselves, where is the purpose? When
mm,
they are doing this stage one,
mm-hmm.
and especially at the stage two, they have to ask themselves, where's the purpose?
Right.
So in category one, where is the purpose? It's not, it was, but it's not in the situation. It was in the situation,
Mm,
but it's not anymore.
okay.
In category 2, where is the situation? Where is the purpose? Nowhere.
Nowhere. Got you.
Nowhere.
Mm, hmm.
Not even in the situation.
Okay. Right.
So in category 4, where is the purpose? And because the purpose is distorted, I had the purpose. The
Mm,
purpose was in me, but it's distorted.
mm,
And in category 4, where is the purpose? Where is the purpose?
mm.
Where you can find the purpose? What do you think?
Well, of course, I'm only thinking of this from my own perspective. But I would say the purpose may be in me, but the circumstances around me have made it difficult for me to experience that purpose.
Yeah.
Like, for instance, my calling to be a minister, but I find myself a high school teacher instead, which was a part of my life years ago. You know, I was definitely in the number 4 situation there.
So the purpose can be located in many places, in me or in the situation. So this is one thing that separates these distortions from each other. There are a lot of other things too, but these two.
Was very thought provoking and very helpful. I like that.
Thanks. And now we go to the second term used by Viktor Frankl, the existential vacuum. Now we have to understand that the existential vacuum is the result of a prolonged, I mean long-term state of
Mm,
one of the 4 states of distortion with experiencing a person purpose.
mm,
The existential vacuum is not a separate disorder from the distortions, and it cannot consist of several or all distortions with experiencing a person. And they can be experienced at the same time because the distortions with experiencing a purpose, they cannot occur in the neurological dimension of consciousness at the same time.
mhm,
A person cannot, for example, suffer from the distortion of a loss of a purpose and distortion of a deliberately distortioning of a purpose at the same time. Because in every experience of distortion with experiencing a purpose, we are dealing with all-encompassing state of the neurological dimension, where it's about a conflict between the activity of either self-transcendence or self-distancing and the situation.
mhm. Right.
So I can have at the same time loss of a purpose or that purpose is missing. It's logically, it's not impossible in any way.
Mhm, mhm,
But I can have in my whole life, I can have first, for example, the distortion of category 1. I can have a purpose that I have implemented, and then the situation then makes it go away. For example, a loss of a loved one. If a
mhm,
loved one dies, so person can lose their purpose, and they
mhm.
don't know how to implement the purpose anymore because the
Right.
situation took it away.
Mm,
And later in the person's life, they can suffer from distorted purpose or something like that. They can happen. Many distortions can people can suffer from many distortions during their lifetime,
mhm,
but not at the same time. And if a person gets proper treatment, for his or her distortion. They will have the equipment to, beat these difficult happenings in their life,
Mm-hmm.
and they can overcome them. So it's not. I don't think that maybe people who are who have this equipment really can. I don't think they can slip into the existential vacuum because they have this equipment,
Mm-hmm.
and they can use them to beat the situation.
Right. In fact, I think this is maybe what Franco referred to as psychological hygiene.
Yeah.
Although I think that we probably should call it noological hygiene,
Yeah, I
you
think
know,
so too. Yeah.
right? Because once you have those strengths, that recognition of the situation, your attitude towards the suffering or towards the existential vacuum, or well, maybe not, you wouldn't necessarily go into an existential vacuum. Might have an existential crisis, though, perhaps. Uh, so, yeah, it's not like it makes you perfect and invulnerable. It just means that it gives you the tools to deal with it as it comes. And so, yeah, I think I can relate to that very much too.
I have seen that happening.
Hmm.
People who come to a logotherapy with their problems, and they are diagnosed, and they have one of the four categories, one distortion, and they get the proper treatment.
Mhm.
They will have these abilities. They will have all the equipment to to you know to carry on their lives and implement purposes. And when something bad happens in our life, it's bound to happen sometime. Something
Mhm.
bad or something that's shaking ourselves. Then they can use all the abilities. Then
Mhm.
they know how to use them, and they
Right,
don't slip into existential vacuum.
right.
They know how to stop it,
Hmm.
and they have this all this the chest medicine.
Yeah.
Sorry, what is it?
Medicine
Chest,
chest.
chest
Yeah,
medicine. Yeah, like Faber said, medicine chest, not chest medicine. Medicine chest,
yeah.
of course.
It's
Yeah.
quite all right. I have a
Yes.
personal example, if I may use it. So I am now on my fourth month in a new ministry in a completely different state. So my wife and I, uh, who we've been married for almost 36 years, we spent our entire married lives in Atlanta, Georgia, and of course I'm a native of Georgia. And my wife made Georgia her home when she immigrated here from Korea. But all of a sudden, here we are in our late 50s, and we find ourselves in Texas, in San Antonio, and I am serving a church. And about my second, no, maybe my third Sunday, I woke up on that morning with a very dark, heavy cloud. I'm going to say existential crisis, and I really didn't know why, but there was anxiety involved. But I made it through the day, and then Monday, Tuesday, and by Wednesday morning, I was really trying to figure it out. And for me, one of my tools of my noetic toolbox is prayer, of course. And so I was praying and meditating and listening. And finally, the answer came to me. And the answer was, this is not my anxiety that I'm feeling. This is the anxiety of this whole congregation of people that I was experiencing. And as soon as I recognized that, I felt 100% better because I said, "Oh, now that I understand where this anxiety is coming from, I can deal with this." Uh, that came to mind as you were describing this. I don't know if that's really true or not, but to me, that means that through my logotherapy, therapeutic training, through my understanding, having these tools in my medicine chest, I think that helped me to diagnose this situation and then come to a workable purpose in this process.
You are the perfect example of this. Perfect example. Thank you.
Thank you.
So, in this categorizing, either A, the operation of the situation in relation to one of the agents of the neurological dimension, or B, the operation of one of the agents of the neurological dimension in relation to the situation, A or B, causes a state of perceived distortion with experiencing a purpose, which is specific and not analogous to other perceived states of distortions. And I mean, again, categories 1 to 4. And now some examples of this. For example, in the experience of losing a purpose, there is a conflict between self-transcendence and the situation, where A, a change in the situation changes the activity of self-transcendence. In the experience of distorted purpose, it's a conflict between self-transcendence and the situation, where B, a person's life feels alien to them, even though the situation has not changed anything. So you can see the difference between losing a purpose or that the purpose is distorted. In an example A, situation, there has been a change in the situation. And an example of distorted purpose, there hasn't been any change in the situation. But still, I feel that something has changed in me. And when such a person self-distances themselves, they no longer recognize the purposes they have found and implemented as their own, unlike in the experience of losing a purpose, where the purposes are clear and they have been recognized in the act of self-distancing in the past. A distortion in which both of the agents of the neurological dimension of consciousness would be in conflict with the situation at the same time, that cannot logically exist. Because an experience in which a purpose, for example, a purpose is missing or a purpose hasn't been able to discover it. And an experience in which the purpose is lost, distorted, or has been distorted by the situation cannot be simultaneously recognized at the same all-encompassing state in neurological dimension. So it's one distortion and one state, and there can be all distortions and all the states at the same time. And now I have a picture of all these again. So here you can see the general description, existential frustration, which is Viktor Frankl's own term, and existential vacuum, which is also Viktor Frankl's term. So general description is this, and the specific descriptions are these. And any one of these, 1, 2, 3, or 4, as long-term state can become existential vacuum, the state of existential vacuum.
Right.
So the genesis of the four distortions related to experiencing a purpose. So I have said it before, they differ either functionally or qualitatively from each other. In the genesis of a distortion, the functional process means the conflict between one of the two agents of the neurological dimension and the situation. And the qualitative process means the difference to which the conflict in the activity actually targets, or where, for example, the particular conflict of the distortion of purpose is directed or where it can be located, and what kind of manifestations that targeting causes in a person. An example of this. In the second category, which means that purpose is missing, there is a conflict between self-distancing of the neurological dimension and the situation, where the perception of the self in relation to the situation is distorted either in such a way that the situation dissipates or fragments the experience of the self in the act of self-distancing, or such in a way that B, the self experienced in the act of self-distancing does not relate to the situation in a way where a person would understand that they are part of their situation, but they feel that they are detached from their situation.
Right.
So there are types.
Yeah, and I think that maybe we talked about this before, but self-detachment can have a negative situation, right? Where you feel detached from your situation. We usually think of self-detachment as a way of stepping outside to analyze and look at it. But I'm sorry, just thought I'd throw that in there.
So what I'm trying to say is that the division into A and B type distortions in the second category of distortions, that's necessary, because in each type, the conflict between self-distancing and the situation operates in different ways. And this is a case of a qualitative difference in the genesis of the distortion. A and B type distortions also manifested as different symptoms in emotional life and behavior.
Yeah.
So the two-staged separation diagnostics of disorders, it refers to a diagnostic process in which in the first stage, which I call separation diagnosis, which means the practice of existential analysis, it is distinguished whether the client has a distortion or an existential vacuum, and it means whether or not a therapist recognizes that the client has a distortion or an existential vacuum. At this stage of diagnostics, a therapist does not need to try to diagnose which specific distortion it is. It's enough that a therapist recognizes or does not recognize a possible distortion or an existential vacuum. So the first stage is about separation. But in the second stage of the separation diagnostics of disorders, which I call detection of the cause, logotherapy is started with a client in whom a therapist has detected a distortion or an existential vacuum. It really doesn't matter at the first stage which one it is, but if it is, that's all it takes. And at this second stage, a logotherapist must also distinguish which specific distortion from categories 1 to 4 is involved. Also, in the case of existential vacuum, a therapist should identify what specific distortion has caused the existential vacuum. I think it's easy to detect the existential vacuum. It's easier to detect the existential vacuum than a specific distortion. because
Okay.
it's so obvious. The existential vacuum, uh, the person manifests the existential vacuum in the ways that are very obvious. So it's easier to diagnose the existential vacuum than it is to diagnose the specific distortion. But
Mm-hmm.
treating an existential vacuum needs to go back to detect the original distortion and start treating it, because the existential
Mm-hmm.
vacuum is
Mm-hmm.
a prolonged
Right.
state of some specific distortion. And again, here I have the final picture. And this is a representation of the whole two-stage separation diagnostics of disorders.
Mm-hmm.
And in the left, there is the first stage of the separation diagnostics, and practiced by existential analysis, because this is the right practice. This is the right mm, right way to do this
Mm-hmm.
first stage. But if a distortion with experiencing a purpose is not detected, that means that logotherapy does not begin. And
Mm-hmm.
in these cases there are three alternatives.
Okay.
In A alternative, the client is directed to psychotherapy
Mm-hmm.
if a disorder of the psychic dimension is suspected. And now I use the word suspected. And this is
Mm-hmm.
because a logotherapist in uh, all the all the disorders or the functioning, the functioning of the psychic dimension is I myself I train and I teach the in the logotherapy training. I teach the functioning of the psychic dimension too, of
Mm-hmm.
course. But these disorders of the psychic dimension, they are not the field or expertise of a logotherapist, or the field, they don't belong to the field of logotherapy.
Right.
The disorders in the neurological dimension,
Mm-hmm.
these are distortions related to experiencing a purpose. They are the field of logotherapy, but
Mm-hmm.
uh, uh, not these disorders of the psychic dimension.
Mm. Right. Right.
So I myself, as a logotherapist, I'm just a psychology teacher. So I'm
Mm-hmm.
not a psychologist, a psychotherapist.
Right.
Uh, that's not my expertise. My expertise
Right.
is the functioning of the neurological dimension.
Right.
So
Right.
I can only suspect. I cannot do a diagnosis of any
Mm-hmm.
disorders of the psychic dimension.
Mm-hmm.
I can only suspect.
Yes. This is a great distinction for me as well because um, obviously in my line of work, I don't diagnose or work with psychic or somatic issues. As a pastor, I definitely deal with a neurological dimension. So obviously, then if someone is experiencing a problem, if I determine that it's a distortion of purpose, we may go into a form of pastoral logotherapy. If
Yeah.
not, I may say, go see your cardiologist, get a heart test or this is, or if they're having they're bipolar or whatever. But I do feel like I have some knowledge about that, not in terms of treating it or diagnosing it, but in terms of recognizing that it is not neurological, I guess. And for that reason, I don't have the clinical training, and my diplomate is in logo philosophy, not logotherapy. But wow, what an interesting distinction there.
Mm, mm. I think that many logotherapists think that they are psychotherapists, and
Right.
they have the expertise uh, of the disorders of the
Hmm.
psychic dimension.
Right.
So if they think so, they would have to be psychologist too,
Hmm. Yes.
psychologists, or at least they have to have a training, a degree
Right.
in psychology, or
Clinical
in
psychology. Yes.
yeah.
This is my problem. If I wanted to start a practice and receive uh, clients or pay, whatever you call them, um, I couldn't just do it as a logotherapist in the neurological dimension because I can't get licensed without the clinical training. You know,
Uh-huh.
as a
Okay.
pastor, I am covered. Pastoral counseling is covered. I've got all the credentials and you know the whatever I need for that. But if I wanted to start a practice, even if I only wanted to work with the neurological dimension, couldn't do it without a license. Well, I guess I could, but I don't think people would respect that. I don't know. It's an interesting issue for me.
Mm. And this is also because of the responsibility. If
Hmm.
your
Yes.
training if one's training doesn't cover the uh, the psychological studies and research
Mhm.
and the degree in psychology, I- so you cannot you you cannot have the expertise,
Right.
and you may cause damage
Correct.
to a client. So it's about responsibility.
Hmm.
Mm.
Yeah.
Okay, so the alternative B will be if I don't, for example, I'm doing this stage one diagnostics. If I don't detect uh, neurological disorder, if I don't detect anything, the client may be directed to some other place, or B, the client will be given information about logotheory,
Hmm.
logophilosohy, for the
Yeah.
purposes of potential self-study. Or
Hmm.
C, a therapist discusses with the client about the reasons for which the client seeks logotherapy. And a therapist can suggest a revisit. And this is, in many cases, this is needed because the situation, the conditions can be very vague. Time is
Hmm.
up, and you really don't know what to do, and
Right.
you suspect something, but you really can't get a hold of what it is.
Hmm.
And in these cases, I may discuss the reasons, but still, I feel that something is left out. And in these cases, it's good to suggest a revisit. And when
Right.
you
Hmm.
can maybe able to find something to hold on, something that tells you is or is there not distortion. And in this alternative B, I have had these kind of clients that come to logotherapy and are very curious and ask very, very, very much everything.
Hmm.
And I start to wonder if this is just curiosity or wanting to learn more about logotherapy.
Hmm.
And in those cases, I don't detect anything. I don't detect any psychic problems in the psychic dimension. I don't detect any problems in the neurological dimension. I just feel that they are curious and they
Hmm.
want to know more.
Hmm.
Therapy is therapy. Therapy is not the place to educate people or train people
Right.
or teach people. It's a place for treat people, not to teach.
Hmm.
So at this point, I I just give the information about logotherapy and logophilosophy, and I give them some book, maybe names of some books or or websites or something like that, so they
Mm-hmm.
can self-study,
Right, right.
and that's
Good.
good.
Yeah.
At this first stage of the separation diagnostics, if a distortion with experiencing a purpose is really detected, no matter what is the distortion,
Mm-hmm.
then logotherapy begins.
Mm-hmm.
And it has two phases, A and B phases. And in A phase, a diagnosis about the specific distortion with experiencing purpose is made. And this is the second stage, of course. And
Mm-hmm.
there are four categories. And I hope that a logotherapist is so educated that he or she can, the first at the first two sessions, can find a right diagnosis. But sometimes
Mm-hmm.
it takes longer. It depends on the client. It really depends on the client very much.
Mm-hmm.
And in the phase B, a therapist clarifies for themselves which concrete remedies to use.
Mm-hmm.
The most optimal form of logotherapy,
Mm-hmm.
we which to start with, and the most optimal treatment methods concerning the diagnosed distortion, uh, with which to start. So there are a lot of decisions to make at this second stage, and
Mm-hmm.
it may take 2, 3, maybe even 4 sessions when all this is clarified.
Mm-hmm.
And a logotherapist may try several kind of treatment methods until he or she finds the right one that really is helpful.
Yeah. Makes sense.
Mm. But the optimal form of logotherapy, I think this is quite easy because individual therapy, I think I myself try try this almost every time.
Mm-hmm.
Of course, I have couples therapy too, but in most cases of the couples therapy, the problem lies in one of the partners, and one of the partners need individual therapy. So
Mm-hmm.
most of the cases, I suggest an individual therapy for one of the partners.
Right, right. I
Mm.
see.
Since these distortions vary in their quality, they also manifest themselves as many different symptoms in emotional life and
Mm-hmm.
behavior. And this is because, according to the interventionist theory, that was in podcast 1. And in my book, it was on page 12. The functioning of the neurological dimension of human consciousness affects the functioning of the psychic
Mm-hmm.
dimension, and through the psychic dimension, also the somatic level of the
Yes.
individual.
Mm-hmm.
So, if we begin to treat a person suffering from a disorder using methods based on a dimension of consciousness other than the one involved in the disorder, we may, in the worst case, cause the client to develop an iatrogenic or iatrogenic, how do you say it?
I say iatrogenic, but I think
Okay,
iatrogenic is fine.
okay, I say from now on, I say iatrogenic neurosis. Yeah. And this is the worst scenario. But at best, we have wasted the clients and our own time with
Mm-hmm.
inadequate treatment.
Right.
And very often, a diagnosis is made based on the client's symptoms, and this is the type 1 in the traditional
Mm-hmm.
medical diagnosis of symptoms. But however,
Right.
symptoms manifested in emotional life and behavior do not in itself reveal anything about the
Mm-hmm.
dimension of consciousness in which the disorder originated. This must
Right.
be remembered.
Yes.
And therefore, instead of using the diagnosis type 1, more important is to distinguish between the psychic and the neurological disorders. And
Right.
by that, I mean exclusion diagnosis type 5,
Mm-hmm.
which I call separation diagnosis
Mm-hmm.
at the stage 1, and then to identify the root cause of the disorder. And this is stage 2. And type 3, the definition according to causality. And this is what I call detection of the cause.
Mm-hmm. Right. As I like to say, most of us cannot tell the difference between a heart attack and a panic attack. The symptoms are almost identical.
That's right. That's right. Because when I was younger, around 30, I lived a stressful time. I was studying and working at the same time, and I had
Mm-hmm.
so much going on. And okay, one time I was at the library, university library, studying to I don't know what exam it was that time, and I felt uh, so much pain in my chest. And I thought I was dying. I thought I was having a heart attack. I really did. I really did. And I felt that I'm dying there. I can't do anything anymore. So I called my friend that he she has to take me to the emergency. And she did because she was very worried. I was crying. I said, I'm going to die now. And
Mm-hmm.
we went to the emergency. And I told her I love her and said say hello to say that I love to my loved ones and I farewells and everything. I cried and I they gave me they made me eat EKG
Right.
heart,
Right. Mm-hmm.
and I was lying there crying and saying farewell to everyone. And the doctor came and said, you have a cramp, a cramp, muscle cramp.
Yeah.
You have very tight muscle cramp. Take a painkiller now, and it will be over in about 30 minutes.
Okay.
and and she came, and the doctor gave me a painkiller,
Mm-hmm.
and in about 30 minutes I was fine.
Yeah.
I really had a cramp, and I think it was because I had some sort of a panic attack, panic
Right.
dis. So
Yeah.
I didn't have I never had it before, so I didn't
Right.
know it was could be like that. So
Mm-hmm.
the symptoms for a heart attack and a panic attack could be very similar,
Right.
but the
Mm.
treatments are very different, as
Right.
as we know, as everyone knows. So the forms of providing logotherapy and its treatment methods depend entirely on the particular category of the disorder diagnosed, and the categories 1 to 4. And this also applies for the state of existential vacuum because, as we remember, it's a long-term state of one of the categories 1 to 4. And therefore, it's very important that the logotherapeutic diagnosis is made correctly, bearing in mind the specific quality of the neurological dimension of human consciousness. And in Handbook of Logotherapists, which I have right here,
Mm-hmm.
there are descriptions of multiple logotherapeutic treatment methods, and I have case examples too from my own practice, and there are descriptions and about forms of logotherapy, along with the description of a logotherapy process and
Mm-hmm.
logotherapeutic exercises to use in therapy.
Mm-hmm.
So it's very handy. But most of all, it must be remembered that the logotherapist is always the most appropriate person to evaluate how and why specific methods and logotherapy forms are used. It
Mm-hmm.
depends on the logotherapist themselves. Because in a therapy session, everything planned can suddenly change. Everything you have planned and thought about, they can just vanish because the things can change and
Right.
new information comes and the therapist they need to know what to do next, what to say
Right.
next. And that is why hard study, just hard study and diligent training, they are the best friends for any logotherapist.
Agreed. Agreed. Amen. And by
Now,
the way, so go ahead.
these are the sources, and this is my last my last slide. Go ahead,
Well,
Tom.
we're not finished, of course. In other words, we have lots more to talk about, but I think this is a good time for me to hand you some compliments on this. First of all, um, your book is very academically rigorous, which is a very good thing. And I think Viktor Frankl would be, I don't know for sure, but I think he would be very proud of your work, particularly the way that you have brought in, interventionist theory and Laurie Raoula, I can't say his name very well, but and even this further classification of diagnostics. I am working through now the new book by uh, Alexander Batyani, the one about the broken
Ah,
lineage. I don't know if it's going to show up or not. And I'm about 2/3 of the way through that. About the importance of the keeping logotherapy's anthropological foundation sure or secure, and also that it's a very deeply philosophical issue. I'm also working through, thanks to a colleague of ours, an English translation of Der unbedingte Mensch. The
okay.
Yeah, and so that's a book that's not available in English, and that's also very philosophical and rigorously
Mm.
academic work. Some metaclinical lectures. So, the other compliment I wanted to give you, in addition to situating your work in that at that level, is to say that because of these podcasts, I understand your handbook better, but I think I understand logotherapy better as a result. So
Thank you so much.
you're very welcome, and that's why I have to strongly recommend that not only do people watch these podcasts so they can hear you talk about it, but also that they buy the book, they can read it and digest it and reread it and digest it some more. Because I know if you're going to have a clinic or a institute of logotherapy, you really have to know what you're talking about. And clearly, this handbook demonstrates uh, that your institute for purpose-centered philosophy there in Finland is very well grounded in what we might call classical or orthodox logotherapy. So great work.
Yeah, yeah, thank you so much. I really have uh, used so many years. I have spent so many years building this institute and
Hmm.
training programs and theories, making theories, developing things, and at the same time, I experienced, me and my colleague, we both experienced that we have stayed in the foundations of the of Viktor Frank's logotherapy because
Mm,
everything is from that basis. So it's
right.
not any application; it's straight from the basis of logotherapy, Viktor Frank's logotherapy, and that is what I'm very proud of myself.
Mhm. Well, you have done me a great favor by these 5 podcasts, and I know we have many more things to talk about. So there will be more to come. And thank you again for your time. I guess we have been at this for almost an hour and a half,
Oh,
so
okay.
we should give everybody a break. Uh, but as one of my teachers, Dr. Ann Graber, would say, it's bye for now.
Thank you so much, Tom. And I wish you A happy